Dr Akshita Singh. I'm a senior breast consultant surgeon at Mazumdar Shaw Medical Center, Bangalore. I specialize in both benign and malignant breast diseases, and my favorite, go-to thing is cancer survivorship. I think it's very, very important. Every cell in the body has a rate of division and death. And nature has made it in such a way that usually this is very beautifully balanced out. Occasionally what happens is the rate of division exceeds the rate of death, and then you have this clump of cells that are growing at an abnormal rate. If they grow for long enough, they will eventually invade into the surrounding tissues and also may be spread to other parts of the body. And that is cancer in short for you, and anything that develops in the breast would then be labeled as a breast cancer. So breast cancer is quite common actually. If you look at Western data, about 1 in 8 women in their lifetime will get detected with breast cancer. Thankfully, we've still not reached that point where we are looking at those numbers. But India has, if you look at rural India, it is anywhere between 1 in 60, and urban India is around 1 in 30. Bangalore is actually 1 in 22. So, 1 in 22 women will get diagnosed with breast cancer. And if you look at our population, there's a large number of women who are at risk for developing the disease. And it's important because like all cancers, not just breast, but like all cancers do not have signs or symptoms in the early stages. There will just be this very insidious sort of growth there sitting, biding its time. And it's very, very important that we are aware so that we can detect it much earlier and thereby, save more women if we do that. I think the most common symptom that we should be looking for when we talk about breast cancer is the presence of a painless breast lump. And that, according to me, is the most important thing that women can look out for. We have a huge number of women who walk into OPD who have come in really late because they don't have pain in the lump. Thinking that if it is painful, it's more, it's likely to be more dangerous. If it is not painful, then it's not dangerous. Whereas breast cancer is the exact opposite. So a painless breast lump is what we're looking at. And additionally, there can be, very subtle signs such as dimpling. Like you have dimples on the cheek, you can have dimpling in the skin in the breast. And that can be a very, very early sign. Sometimes the lump may be sitting, deep within the breast tissue. You may not really feel it, but you might notice the dimpling on the skin. Or you can have, blood-stained nipple discharge. Any of these can actually be very, very early signs of breast cancer. I think the first go-to doctor should be a breast specialist. So you need to go to somebody who examines women, in terms of breast-related diseases, because we have to remember that not all lumps that women have are cancerous. So it's really important that you get examined by somebody who works exclusively with breast diseases, and that would actually be a breast specialist. If you don't have access to a breast specialist, then maybe an oncologist would probably be a better bet. So according to me, breast self-examination is the most important thing that women can do. We often rely on investigations to an unnatural extent. What we don't realize is that any investigation that you do, especially for breast, whether it's an ultrasound or a mammogram or an MRI, is like taking a photograph. You take a photograph today, it will tell you what's the situation today. It's not going to predict what's going to happen tomorrow. While predictive ability of tests may exist for some certain areas, most of the time for breast it is not predictive. By that logic, you'll have to end up doing scans every day, because if you do a scan today, there's no guarantee that nothing will go wrong tomorrow. So I think that's where a breast self-examination comes into the picture. All women above the age of 30 must do it. It's something that's really simple, is obviously done at home by the lady herself. roughly takes 2 to 5 minutes on an average and needs to be done only once a month. And it is where the lady examines herself for the presence of, a lump or any difference in the breast. The whole point of doing a breast self-examination is not that you will go to the doctor one fine day and say, "Doc, I've got a cyst at 11 o'clock in the breast." No. The whole point, or that I have a lymphosarcomatous growth. The whole point is that the lady gets used to the look and feel of the breast, so that if anything unusual crops up, she herself will be able to say, "Hey, this lump or this discharge or this change in the breast was not there last month, and this is something new, I need to go get checked." A lot of women get very, very dejected because they often tell me, "Doc, but I can't make out what's happening in the breast." You're not supposed to make out what's happening in the breast. You are supposed to know what your baseline breast looks and feels like. It will roughly take you about a year and a half to really understand, and post that it will be relatively simple for you to know that if there's been any difference from the month before. Especially for women who are who don't have access to investigations. I think a breast self-examination is a really, really great way of staying in tune with your body. I think the simplest way is a breast self-examination, and it needs to be done once a month. If you have your menstruation on a regular basis, then it needs to be done 4 or 5 days after your menses get over. If you are not menstruating, that is your postmenopausal, then you probably need to fix one particular day in the month and do it. It is basically using the tip of your fingers to feel the entire breast and the armpit, to look for any new change. You also look for the size, shape, symmetry of the breast. You look for position of the nipple, and you do this while keeping your arms by the side and also raising your hands above your head. You can also gently look for any discharge, especially blood coming from the nipple, and I think that is the most important thing that women can do at home for themselves. I think all women above the age of 40 should go for a clinical breast examination. So it's really important that a breast specialist examines you to make sure that there is nothing new. And scans are usually at the discretion of the specialist. So that can be an ultrasound or a mammogram. But after the age of 40, I think once a year would probably be the right way to go about it. So probably in a month, if we include all stages of breast cancer, we are looking at up to 50 to 60 women a month who are newly diagnosed or who have been, come to us with recurrent disease. So we probably look at some around 50 to 60 women of breast cancer, new breast cancer cases every month. And we look at a fair number of women who are on follow-up. So, women who've completed their treatment. And that number can be anywhere between 150 to 200 women per month who come to us for their regular, periodic follow-ups. Yes, I think there's a significant rise. There is a significant overall rise, increase in the incidence of breast cancer in women. And I think our population is definitely younger as compared to the West. So if you look at the age of diagnosis of breast cancer, in the Western population, the median age is somewhere around 58, 60. And India is around 47, 48. So we are already a decade younger when it comes to the age of diagnosis. And we definitely see a fair share of women who come in who are less than 40 at the time of diagnosis. So yeah. The general ground rule is the earlier the detection of the cancer, the fewer number of treatments you're likely to need. So when the breast cancer is in early stages, that can be stage 1 or 2, or slightly more advanced stages, which is stage 3, surgery is the predominant role of, it's a predominant mode of treatment as surgery. And then that can be supplemented by additional treatments such as hormone therapy, immunotherapy, chemotherapy, targeted therapy, and radiotherapy. What we have to realize is, as your stage goes up, the need for additional treatment apart from surgery will also go. So if you are in early stages, sometimes surgery and hormone therapy in the form of tablets is what you need, and then your recovery, your entire intensive phase of treatment may get over in a month and a half. Whereas if you look at really advanced stages, where you're looking at stage 3, your intensive phase of treatment can last anywhere between 6 to 9 months, and your extended phase of treatment can be another year of injections. So there's a vast difference between the amount of treatment you need when you're early stage versus when you're late stage. So roughly 40 to 50% of the women who come to us are in advanced stages of breast cancer. And the number of women who come to us, or the percentage of women who come to us in early breast cancer stages, is only about 20%. So despite everything, it is still a measly 20%. Most of the women are very, very advanced, often metastatic when they come to us at presentation. So the general concept that I've come across in women is that if I go to a hospital and I get an investigation done, then something will get detected, and that something that's detected is going to be cancer. 60 to 70% of women will have a breast lump in their lifetime, which is not cancerous. So to have a breast lump is not, it's not mandatory that if you have a breast lump, it is cancer. Very often than not, it is not cancer. And sitting at home fretting about it doesn't really solve the problem. We have so many advancements in treatment now that a lot of the times all you need is a small surgery to just get the lump out. You don't even need to remove the breast. You don't need prolonged periods of treatment. And I think it's this fear of having the breast removed, or the fear that this is definitely cancer, the fear that I'm going to be under treatment for a very prolonged period of time. These are the things that don't let women really come to us in the first place. Mammograms are considered as the gold standard, and a lot of women are very scared of mammograms because it's painful. So they think that, why go through the pain? Well, if you really don't want to do a mammogram, then it would be ideal to get a clinical breast examination, which I think is equally, if not more important. So get yourself checked by somebody who does this on a regular basis. You can supplement it with an ultrasound. You also have an MRI breast. So, there are various options that are available, and mammogram may not be the only thing that you have to do. It still is the gold standard, and it is the best investigation that is available in today's day and age for screening of breast cancer. But apart from that, any of these other modalities can also work, an ultrasound, an MRI, an examination, any of these. That's a really, really important point, because we don't stress enough on lifestyle changes in women. Breast cancer is one of those cancers which have been conclusively proven to be associated with increased BMI or body fat levels. Having the ideal body weight is a sure shot way of reducing your risk of developing breast cancer. Exercising regularly, so avoiding a sedentary lifestyle, is something that's very, very important. Cutting down on high fat diet, cutting down on processed food, especially processed red meat. All of these are definitely known to increase your risk of breast cancer. limiting the amount you drink and avoiding smoking is also another great way of really reducing your risk of breast cancer. The most common fear is that they are absolutely convinced that they have breast cancer when all they have is a lump in the breast. And you have to spend, if not more, an equal amount of time telling them that what they have is not cancer, because they're so convinced that what they have is cancer. So it's really important for women to know that every lump that they have is not cancerous. And for most of these lumps that are not cancerous, you don't even need to do anything. You don't need to take treatment, you don't need to do surgery. You just need to stay on follow-up with your specialist, and that's all that's required. So I think that's very, very important. So I think two of the most common myths that I would probably say, which delays the diagnosis of breast cancer in women. The first myth is that, like I said, that it has to be painful if it is cancerous. It is never painful. So a painless lump is something that's much more dangerous, and that's why a lot of women come to us in very, very advanced stages, because they're waiting for the pain to show up. And it's really sad, because a lot of these women have diseases that can be treated, where they can be cured, and they don't come to the hospital because they're waiting for the pain. And I think the second most common thing which troubles me a lot is, not all lumps that you see in lactation are milk lumps. So this is again something that's related to the disease, with the theme of invisibility. A lot of women who are breastfeeding their children will develop a lump in the breast, and we've seen a lot of the times where these lumps have been they've been classified as a milk lump, and the lady has gone to multiple people, multiple doctors, and she's been sent back saying it's a milk lump, and it ends up being a cancerous lesion. So again, if the lady is breastfeeding and there is a lump in the breast, she needs to be checked. She needs to go to a hospital, and she needs to get it evaluated. With the kind of technology that we have in today's day and age, there is nothing that is not available in our country which is present in a much more developed nation. I think we are at par when it comes to any form of treatment for breast cancer, and when detected early, almost 90% of women cross their even 10-year survival mark. So I always tell women that it's often the first step which is the hardest. Once you actually take that step, there are going to be people around you, whether it's your treating physician, whether it's your family, whether it's your friends, your colleagues, who will hold your hand through it and get you past it. And it's always just this first step where there's a lot of hesitation, and rightly so, there's a lot of fear. But once the journey starts, a lot of the times women come back to us and tell, we finished our treatment today and you told us that this day would come, and all that anxiety, that hesitation is, it eventually melts away. So it's just a matter of starting the journey, and then eventually you will overcome it. There's no way you can't. No, not all lumps are a sign of cancer. Actually, between the ages of 18 to 35 or 18 to 40, 6 out of 10 women will have some sort of lump in the breast, which is not cancerous. Of course, this number goes down as you get older and as you become postmenopausal. But no, not all lumps are cancerous. There are, tremendous number of lumps that can happen in the breast, which are not cancer. So the point is, if you notice a lump, go to a doctor, and you'll probably be told that it is not cancer. Instead of, so I have so many women, who've not slept for weeks and months, who've not told anybody in the family because they are convinced that what they have is cancer. And once they tell somebody, they'll have to go through the whole treatment. only to be told by us that it is not cancer. So, you can save yourself weeks and months of worry and anxiety and just go to a doctor. One of the hallmarks of cancer is its ability to invade surrounding tissues and to spread to other parts in the body. So the cancer may start in the breast, but eventually it will grow inside the breast, and once it has reached a certain level, it will also decide to spread. So it will actually these cells will get into the bloodstream and then go to different parts, for example the lung or the bone or the brain, and form small areas of cancer in them. So early stage is where the cancer is limited to the breast, and metastatic is where it has moved out of the breast and it has gone to other parts in the body. So this is something that's very, very close to my heart, because there are 3 forms of recovery post treatment, and we only focus on one, which is the physical recovery. Physical recovery is actually quite quick, because once you finish your treatment, physically you kind of feel some sort of semblance to your previous self, maybe 3 to 6 months post completion of treatment. And that's when I say that most women tend to get better. They eat better, they sleep better. A lot of women who go through chemotherapy and who've lost their hair will see the hair come back. Your overall appetite improves. So I would probably say 3 to 6 months. And then the other 2 forms of recovery is something that we don't talk about enough, which I think is sad. The second recovery is the mental health recovery, and that I've seen takes much more longer. Which is why we need more women to talk about their journeys. We need more women to form support groups. We need more women to not be bogged down by the stigma of breast cancer, because it's only when you talk to people who've gone through the same sort of experiences in life that you actually can connect. Somebody very close to me who's also a cancer survivor very recently told me that even in a room full of people, I feel like I'm all alone because I cannot connect with anybody. And she's it's been quite some time since she's finished her treatment. So this is not somebody who's just finished it and she's feeling this. She looks just like us, but she says, I look like you, but I don't feel like you, and I don't feel like anybody in the room. So the mental health journey is something that takes time, and it's very important. Like we routinely tell our patients to go for counseling with counselors who work exclusively with cancer patients. So I think that's important. And the third recovery is also something that unfortunately is a form of recovery that only you can take alone, and that's your own spiritual recovery. That also, according to me, takes time. It is your battle with your inner self, and I think that takes a little more time than the mental health recovery as well. But I think women are inherently strong. We are built different. So I think women do tend to come out of it quite victorious, but it takes time, effort, energy, and a conscious movement towards it. There are countless stories of women who've come in early, who've gotten away with just surgery and maybe just a few medications such as tablets, and then there are countless stories of women who haven't come in early, and they are all as heartbreaking as the previous one. So I would probably focus more, maybe it's the sort of person I am, but I will probably focus more on the women who didn't turn up. We've had a lot of women. So there is this exceptional story where this lady walked into our OPD with very early stage breast cancer, and we told her all you need right now is surgery, and you will not need anything else, maybe radiation, but just surgery. And for some reason she got really scared, and she had a lot of other cardiac issues, so she got very worried, and she said maybe I won't survive surgery and all of that. And then she unfortunately didn't stay in the loop, and she came back to us 3.5 years later with she didn't go to anybody else. She didn't take any treatment. She sat at home. And unfortunately, when she did come back to us, it was very, very advanced stage. And it took us a month of counseling to finally convince her to come, do the treatment, take the treatment. And guess what? I think it's been 3 years now since she's finished treatment for the advanced stage and she's still doing okay. So the point is, go to the hospital, come see us, come see anybody, go see anybody. It doesn't matter what stage you are in. It can be treated. Even if you're a stage 4, there are treatment options. Stage 4 is not end of the road. So a lot of women think, oh, because it's stage 4, there is no treatment, we can't do anything about it. It's not that. Even if it's stage 4, there are multiple treatment options. And so, somebody recently with metastatic breast cancer told me that, but doc, you're telling me this will only work for on an average, this will only work for 36 months maximum. I said 36 months is 3 years. At the rate at which technology is changing, 3 years later we'll have something new. What I'm telling you today was not there in the market 5 years back. 3 years later, who knows where science, technology will take you. So the point is, don't give up hope. It doesn't matter what stage you are in. As long as you take treatment, you should be okay. The most important message that I give to actually all my patients in the OPD, that I think a lot of treating clinicians do the same, is to keep the faith. It's very important that you keep the faith in everything around you, in the person who's treating you, in your family, in the larger scheme of things in life, and eventually destiny, because a lot of the times this battle can be a little lonely. While you may have everybody around you and you may have the best team, sometimes on a personal level it may become very lonely. And then a lot of patients have told me that what really helps them get from day to day is to keep the faith. So I think it's very important that you remember that there are treatment options, there are plan A, plan B, plan C, plan Z's, and there is always light around the corner. So that we just have to wait for it.